Okay, welcome to the trenches. I'm going to talk about a quick patient I saw today. This situation comes up once in a while, and it's the vascular disconnect. The patient's a 75-year-old woman with a history of hypertension who came into the hospital with back pain, chest pain, and abdominal pain, and she was pan-CAT scanned. And what it showed was some atherosclerosis of her aorta and iliac arteries. That's what it showed. No history of vascular disease. Of note, her lipids were a total cholesterol of 154 with an LDL cholesterol of 86, an HDL of 56, and triglyceride level of 61. She's a non-smoker, doesn't have a family history for atherosclerosis. No cardiovascular symptoms. So what to do? Okay, it's a 75-year-old, basically healthy. Lipids are not a high-risk lipid profile, and her LDL is under 100. But you have imaging of atherosclerosis, so this is where I think a coronary calcium score would be very helpful, and I got this. And of note, this woman's coronary calcium score was 472. So if you break them down into the risk groups, calcium 0 to 99, 99 to 299, 300 to 999, and greater than 1,000. Greater than 1,000, you clearly have, you most likely have blockages. So she's 472, she's right near, she's in a high risk group. And that's telling me I have to start her on a statin. Now, I'd explained to this patient why I was going to put her on a statin with the cholesterol that was on the low side. And I had explained that what the statin will do, and I chose rosuvastatin. I didn't go at the highest dose. I started her initially at 20 milligrams to make sure she tolerates it. And I also placed her on 1 aspirin a day. It's recommended if your coronary calcium score is greater than 100, then you ought to be on 1 baby aspirin a day. It'll lower her cholesterol, but what it will do is it will affect the composition of her plaque, and it'll take the fat and the inflammation out of her plaque and make the plaque less likely to rupture. The calcium won't go away, and there's a shot with the statin, calcium could go up a teeny bit. That doesn't matter. She's still at high risk. And I've seen this year, twice this year, where I've had patients get foot x-rays, and there's some calcification in the blood vessel, and they had low cholesterols, and their coronary calcium score was elevated. But not uncommonly, you're going to image someone's body, and they might have normal or even low cholesterol, and you're going to see calcification and do a coronary calcium score, and the score is elevated, and this is really a vascular disconnect. So I think we helped this patient by putting on her statin. I explained to her we're going to save her problems down the line. Quick case, but I wanted to talk about it. Thank you.